episode of COVID Care series by Apollo experts. Today we have Dr. Praveen Haranath, consultant intensivist and pulmonologist at Apollo Hospitals. He has about 20 years of experience and he's American board certified in internal medicine, pulmonology, and critical care medicine. Alongside his practice in pulmonology and critical care medicine, he also serves as a medical director of India's first TEDdy ICU program. His prior experience in rural, community, and academic setups in the US, his recent stint at Kaiser Permanente in San Francisco area, his TEDdy ICU experience, and his current position at Apollo Hospitals makes him an expert in dealing with complex medical situations. He believes in honest communication with patients and families, and he also feels that healthcare has spiritual overtones. Today, he's going to talk on the topic medical management of COVID-19. Over to you, Dr. Sai.
Hi, Dr. Padma. Good afternoon, and thank you again. As India and the world goes through the COVID pandemic, I know it's a tough situation for all of us. I'm not sure you can hear me too well, but that's because I'm wearing this mask. But if you're watching out there, this is what will protect you. So I would recommend, if you take one thing away from this talk, wear your mask and physically distance. The medical management only follows when this fails. So I want to take my mask off, so hopefully you can hear me a little better. So I was wearing an N95 mask, and these masks, as you know, protect against COVID. And whatever type of mask you have, kindly wear that. Now, once somebody gets COVID, I'm sure everybody knows about it. You've seen WhatsApp forwards, the news, newspapers, articles, your friends. You might have gone through COVID yourself. The treatment is actually fairly simple. I'm just going to take a few seconds, Dr. Padma, to just overview what the body does when you have an infection. The human body is an amazing machine, if you think about it. The lungs are huge. If you stretch the lungs out, they're the size of a tennis court. And their job is to get oxygen in and push carbon dioxide out. And doing this job involves collaboration between different parts of the body. Your nose actually has you from dust and infections. You have the air passages, which have little hair-like structures. You're always moving and pushing out mucus and infections. Now, when all these barriers fail, you still have another defense system, your immune system. And your immune system goes and fights these infections, which are there all the time. In fact, if you weigh the human body, almost 1 kilo of us is bacteria. Some of them are good, and we actually need them. So based on all of this, what we're really dealing with is all these barrier mechanisms have failed if somebody gets infected, but it's very, very well known that the body is actually continuing to fight the infection continuously. So the medical management actually involves dealing with how the body is already fighting the infection and also adding on things which will help the body fight it better. So if you have an average, say a 45-year-old male who gets COVID, it's possible that he got it from a contact. This particular variant seems to be spreading a little more than what we have been used to in the last surge. And once they get it and they're infected, you have these simple symptoms which your body is trying to fight it. For example, you get a fever. You might feel weak. And these are the same symptoms you get with most infections, especially viral. Your body is trying to give you signals to slow down, not exert yourself. And while all this is happening, your immune system, your T cells and your B cells are fighting it. And if you're fortunate to have had the vaccine, your body has already made defense systems to fight the infection. What we have seen in the last few weeks, dealing with patients with COVID, is that people who have been vaccinated have done much better, despite having serious illness. So if we were to take the medical management of COVID as, say, two parts, let's take the first part as an initial infection and what your body is doing, and a second part where you need hospital care. We've found, luckily, that most patients, over 95%, can be treated at home safely and thoroughly. Our anxiety and our panic is realistic. I completely empathize with people who are going through the situation. There is definitely a crunch in terms of resources, but in general, most people can be managed at home. Now, the home care of COVID, you may have had this in your series already. I may be repeating some stuff, but essentially what that involves is making sure that your oxygen levels are not dropping, making sure you control your symptoms of fever, for example, taking acetaminophen or cooling yourself down and making sure that the temperature is controlled, And hydrating well, especially in our weather as it turns to be warmer now. You may be dehydrating just from the weather, but try to hydrate yourself so your blood pressure doesn't drop. In addition to that, keep an eye out and communicate with your healthcare provider to ask them, what else do I need to do? So if you are a very healthy person with no other medical problems, most likely you just have to wait it out, hydrate, take symptomatic things like plain steam without adding anything just to hydrate the mucous membrane, and continue to wait and watch. In about 7 to 10 days, most people do well. Some people who have other medical issues, we call them comorbidities, like diabetes, high blood pressure, immune system issues, where you're taking medicine to suppress your immunity, or you're taking medicines for, say, example, chemotherapy, or perhaps you just got through an infection of some sort, you're pregnant. Any of these situations, or you have underlying lung problems, you should absolutely talk to your doctors and ask them, do I need to do anything different? There's a possibility a doctor may request you to get some blood tests, and these blood tests measure very specific things. These include measuring things like your white blood count, checking what's called a lymphocyte count to see if your body has enough lymphocytes or not, checking to see if your inflammatory markers, which is your body when it's fighting, produces these chemicals which we can measure. And if these numbers are really high for some reason, some people are more prone to more of an inflamed situation. In that situation, your doctor may say, we may need to add extra medicines such as steroid, for example. Then you kind of check your oxygen level at rest and with walking and see what the numbers are. The government of India has an absolutely fabulous protocol with all the details. Apollo Hospital has come out with almost the 37th edition, I think, of the protocol over the last year and few months, where we've been adapting and evolving it based on the latest information. What we have seen is that remdesivir, which we've all heard about, is not required for almost everybody. A small subset of patients requires it. And this is made by a medical doctor. They make a decision based on the patient, their oxygen level, and sometimes their CT scan to take a decision saying we need to use remdesivir. If remdesivir is not available, there are alternate immunosuppressive drugs that they can think about, or there are alternate immunomodulating drugs they can think about. But this is a decision your doctor makes. It is not for home therapy unless you're under the complete supervision of a good healthcare team. The next thing is to think about steroids. Many patients do require steroids to cut the immunity. So as your immunity is building up to fight the infection, you may overshoot the target. And to kind of bring that back in control, you may need immunosuppressive drugs, which decrease your immune response and will help you control the immune system to make sure it doesn't overreact. So when you get a small injury on your hand, for example, you bump yourself, you get a little swelling. And that is because your body is fighting it, your inflammatory system's acting up, and that releases a lot of chemicals to heal the place. The same thing happens in the air passages and the lungs. You end up with inflammation, you get little swelling with fluid, and these things can build up, and if they're not in control, then you end up with trouble where your oxygen doesn't go in and your carbon dioxide doesn't come out. Luckily, most patients actually do well and they don't really require any of this. The next thing to think about is, do you need antibiotics? Honestly, there is no data suggesting that you need antibiotics. Unless you are predisposed to infection due to an underlying medical issue, you don't need it. You don't need doxycycline, you don't need ivermectin. There is no good data that I have seen personally that says that you should use it. Many people are using it. Fortunately, these are more or less safe drugs, but as you know, every drug can have side effects. So it's important to reconsider whether you really need these. Oxygen may be required if your oxygen saturation level in the pulse oximeter goes below, say, 95% or 94%, then you start looking at whether you need oxygen from outside. The government of India and Apollo Hospital has come up with a very nice protocol for proning. It's universally accepted. So just a quick thing on anatomy, Dr. Padma, I keep going back to the basics here, but if you look at the anatomy of the lung, most of your lung is in the back. So when you sleep on your front, which is called proning, you're actually allowing the lungs to open up and expand in your back, which allows the blood to go there and allows you to participate more in the getting the oxygen in and blowing the carbon dioxide out. We don't breathe deep enough. Most of us are just breathing, maybe just using a tiny bit of a lung capacity. So taking a deep breath in slowly, deep breath in, and then holding and breathing out slow is another technique to allow your lungs to expand and use up the oxygen that is already available in the air. Unless you're on the top of Mount Everest, all of us have 21% oxygen available freely to us. Make use of it. Make use of the lungs that you have to expand it. So over the last few minutes, we have talked about the possibility of minor infections in the lung, the possibility of lung infection getting worse, so you need to go to the hospital, the possibility of using your own lung capacity, controlling the fever, using steroids under medical supervision, antibiotics only if you need it, and if you're malnourished or not eating well, yes, a multivitamin might be helpful. Some people have symptoms like, say, runny nose. You could use an antihistamine to see if it helps, to see if the decrease in the runny nose helps. Steam does a great job. Saline drops help moisten the mucous membranes. And of course, it's very general advice. This is not specific medical advice because we have 1 billion people in this country and everybody's got different situation. But most people, you manage this way. Say you end up in the hospital. When do you end up in the hospital? Oxygen's not improving. Your steroid at home is not helping. Then you need to be seen by a doctor to see whether you need a machine to push the air in. All of us are used to hand pumps pumping water out. The lungs are the same. You kind of give extra pressure, you get more oxygen in. So you may need a machine on the face with a controlled apparatus with the pressures to see if you need extra oxygen to be pushed in. And that is called a non-invasive ventilator. You may even need extra oxygen through the nose and mouth using a high flow device. The other thing which we think about when these things don't work is to go on a complete ventilator with a tube in your throat and the machine does the job, which is the ventilator is really an air pump and it does that job. Obviously, in this situation, you need to be an intensive care unit. You're monitored closely. The other parts of your body are watched very closely. Make sure that your kidneys, your lungs, your infection control capacity, as well as your gastrointestinal tract, your brain, everything is watched. Our hospital, for example, has a triage system where we evaluate patients, and luckily with the use of teletechnology, which Padma mentioned earlier, we have one of the largest number of patients we're monitoring remotely all over the country in terms of home management, as well as assisting other hospitals who need assistance, especially with critical care. We are helping them in terms of maintaining and monitoring them. Transporting patients is very difficult, not just because there's not enough beds, but every time you disconnect someone from a ventilator, the lung is like a balloon. Your air is going in and out. You give a little pressure to it to keep the lung expanded. But if you take the ventilator and you disconnect it, your lung can collapse and you can lose oxygen, sometimes very quickly. It takes a long time to put it back up, which is why we recommend that people have a ventilator with something called PEEP, and we use that. Now, none of this is new knowledge. Yes, the virus is new. Yes, there are a couple of things which we are seeing new. But in general, management of these problems has been known for more than 2-3 decades. ARDS management is the experts for critical care know this like the back of their hand. Don't have to worry about that. Very simple principles. Don't overstress the lungs. Give oxygen only that as much as you need. Don't over-oxygenate. Let the carbon dioxide go up a little bit. It's okay. So there are simple principles that we do in critical care for managing even very sick patients. We prone patients, lay them on their stomach. If all this fails, we have measures like ECMO, where we take the blood out, clean it up, put oxygen back in, and send it back in. I mean, I'm saying it very simply. These are very complex procedures, but we have an algorithm of how to do this. Unfortunately, some patients don't have access to this, or their infection or their immune system is overactive and responds too quickly. And then you end up with a situation where we can't save them. There are situations where people go on machines where they shouldn't be on machines. We have patients who we know will not recover. We should not put them on machines because this is doing a disservice to them and to their families. So honest communication on what the patient's actually going through and treating them is what we do at our hospital. And most hospitals around the country are following the same principles. We are part of several groups of doctors who are very interested in delivering the best care possible. And this involves using the standard evidence. In the last 10 to 15 days, some newer data has come through, including things like using an inhaler with an inhaled steroid very early on may prevent people from advancing in their disease. People with moderate illness could take a simple tablet which will cut the immunity and kind of decrease the inflammation. It's a simple tablet used for gout, for example, and under your doctor's supervision, we can try these things. But there is an entire list of drugs which are experimental. And these experimental drugs may or may not work, and your doctor knows best. One request to patients and families watching. Everybody is stressed out now because we all know people who are unwell. Let us take a moment to recognize the healthcare providers who are doing their job. Do our best to minimize their communication and asking questions and getting second opinion, etc. Let's summarize the history and ask them only pertinent questions. Please have trust in your health systems because the treatment of COVID is more or less uniform now. Most doctors know how to treat it. Most patients are doing well. So let's not keep getting opinions left and right and stress yourself out. Most people know what to do. The information's out there. If you want to simplify it even further, it's oxygen, steroids if you need it, and a mask to protect yourself. Pretty much everything else is standard critical care. The one other area which we have seen in this crisis is many people are requiring anticoagulation. We have seen it with other diseases too. Even tropical diseases have shown us that the body tends to get into a clotting phase, and we are using blood thinners to prevent blood clots. Any ICU patient needs to be protected against blood clots, and this we have known for maybe 50 years, and we've been already doing it. What we've realized is COVID-infected patients seem to have more of a predilection to clotting, so we're watching that also. Vaccines are safe despite the tiny, tiny number of side effects we've heard about, which can happen with any medicine or any drug. Vaccines are safe, they do save lives. So masking, vaccination, social distancing, I don't like that term, honestly, you might have heard me say it before, like physical distancing. Please emotionally stay connected to your families as much as possible, communicate well. If you're a diabetic, make sure your sugar is under control. Keep a complete written list of your medications. What is the name of the drug, the generic name, dose, who prescribed it. Keep a list of your medicine. Because doctors also have only 86,400 minutes, just like yourself and everybody on the planet, summarize the information so that their time is used more effectively. List out the medicines that you have. What is your blood group? What is the contact number? These are simple things everybody can do, and it'll be useful in the future also. The medical management of COVID is not very different. Humanity has seen multiple new bugs come and go. The hope is that viruses mutate a lot. They will mutate out of this, and they will mutate into a less infectious strain. But we as a country and we as human beings need to be aware that part of the responsibility of health is on our shoulders. We need to ensure we're eating healthy, exercising, getting adequate sleep, turn off the news, watch it once a day if you want. Don't stress yourself out. Make sure that you're in touch with your friends and family and help people out as much as you can. There is data showing that emotional connectivity improves your immunity. Being socially connected improves your immunity. In fact, if you're able to actually help somebody else, there is data showing your health improves. So there are multiple things you can do to get better. There are simple things you can do to ensure that you don't get worse. It's very important to watch your symptoms. Keep a tab of when your symptoms started, when you got the RT-PCR, and make sure that your oxygen level is checked on a periodic basis. Do the walking, deep breathing, lying on your stomach, and when you require steroids, go for those. After that, when you're in the hospital, the doctors will manage it. We are using higher dose steroids, antibiotics for infection that comes secondarily. Rarely, some people need immune modulating drugs like tocilizumab, for example. You heard about that. These are cytokine storm protectors. So when the body is fighting too much, you have to give them medicines to control the cytokine storm. There are other drugs to come out which are also being used experimentally. And every day we are learning more. Our hope is that despite being in the middle of the storm, hold on to that boat. As long as you hold on to your faith, you will get across this ocean. Now, the issue that I'm seeing with many patients is panic. It is very understandable. Do your best not to panic. If you're ill yourself, try to slow your breathing down. Take medicines to cut the temperature down. There are patients who do need to be hospitalized. If there are no beds available, continue to get on a waiting list. Be in touch with your doctor, and Apollo does have a system in place for home care of even very sick patients. So that's kind of a very big overview, Dr. Padma. I've been speaking for a few minutes now, so glad to answer questions or explain. I've kind of given a general overview. We can get into specifics if you like. Thank you.
Thank you, Dr. Sai. You gave a real good picture of the whole realm of the COVID-19 management, starting from your immune system, how the body defends if there is inflammation, if there's infection, to what drugs are being used, what are the precautions that the general public have to take. So it was very informative. Thank you for that. So we have a few questions. You did talk about the algorithm of how we are treating the patients. So just to explain the public in very simple terms, what is a mild case? What is a moderate case? What is a severe case?
Sure. So the severe case, anybody can say it. They need oxygen in a high amount. Their blood pressure is low. They're having a high fever. They're breathing really fast. your X-ray and the CT scan look very abnormal, and it's very clear you need to go to the hospital. The mild case are very simple. Your oxygen's okay, you don't have any other medical problems, you're actually not breathing more than 24 times a minute, the saturation's more than 94, and your blood pressure's fine, and you're able to eat and talk and speak in full sentence without any difficulty. Your fever is probably there, but you're controlling the temperature. You're a mild case. There's a bunch of people who fall in the middle, and we call them moderate. And for these patients, we need to measure the oxygen level a little more rigorously, make sure that it doesn't keep dropping below 94. Check the blood work with a blood count to we look at certain parameters. For example, I look at the lymphocyte count. I see if there is more than 1,000 lymphocytes or less than 1,000 lymphocytes. If it's less than 1,000, there's a chance that these patients might get a little bit sicker. That's one thing that we look at. We look at inflammatory markers, including things like the C-reactive protein, ferritin. We measure chemicals like the D-dimer and check and see if there's any predilection towards blood clotting. So these are the things we classify as moderate. And these are the people who can still sometimes be managed at home if you don't have access to a hospital bed, or if you can get to a COVID care center, you can go there.
So just going back to the severe cases, who is at risk for severe COVID?
So people who already have other medical issues, say a diabetic, especially if the diabetes is out of control. So there's a very simple principle. Glucose, if it's more than 250, paralyzes your white blood cells. They've done experiments. You take a person and put a white blood cell in bacteria, sugar goes about 250, the white blood cell can't go and catch the bacteria. So your sugar needs to be under control. It's an epidemic around the world, especially in India, where diabetics don't have the glucose under control. So it's very important to do that. You also have patients who have immune suppression from some other reason. So they may have a more severe case, especially if they're very immunosuppressed and get a secondary infection. Patients who have a predilection for hyperimmune responses might end up with a severe case. But in general, most people are actually doing okay. Pregnant women sometimes end up with a more severe case.
You did talk about how the lungs function, the capacity and the saturation levels. So you did touch upon this again, but I'm asking, what is the value that should put the patient on high alarm and say, I need the medical help? What is that saturation level?
Sure. See, one of the things we look at is the oxygen saturation, absolutely. I take 94 as my cutoff. So if it's consistently dropping below 94, then I think it'll be important for us to think about hospital care or at least evaluation for oxygen. So I'm actually pulling up our protocol to see, we actually classify them as category A, B, and C. And people with age more than 60, we still call them mild if they're doing okay. But if they're older, then you have to really consider these other parameters, including oxygen. Even people who need oxygen, if you're not requiring more than, say, 5 liters, then you're okay. You can still be moderate. But once you end up requiring respiratory support where oxygen levels are dropping, then you end up in the severe category. So your oxygen level is a very important measure. Also the breathing rate. You can all measure this actually. All of us should know how to check our respiratory. You just look at somebody and count how many times they're breathing. That's one breath. So how many times in a minute are you breathing? You should also know how to check your pulse. Not very hard. Take 3 fingers, put it on the hard part along the side of the thumb, put it right there, and you can feel your pulse. Check for 30 seconds, see how many times you count, multiply by 2. So those are simple things which you can do and you can measure.
Yeah, the most common symptom everybody is saying is fever. So if someone has had fever for the last 3 days and their RT-PCR turned out to be positive, which other tests they have to do and what are the medicines they should take?
Sure. See, I think for the fever, we're generally using 6 to 7 days as a cutoff where the fever is not going away. We need to kind of pay more attention. That's a very general thing. It depends on how the patient is doing. Some people get dehydrated pretty quickly and they may need to be in a hospital to get IV fluids, for example. Otherwise, we can give them acetaminophen and lower the temperature. It can be oral, liquid, any form. You can actually control the temperature. And once you get the temperature down less than 100, then you should be okay to monitor. But if it keeps spiking and it's not going away, then it may mean that you need a little more advanced therapy.
You talked about the CT, and people do hear about HRCT. We got that done, and this is what the report says, this is the score. So can you explain in simpler terms for public to understand what is this score that we're talking about, and what does it say?
Sure. So, the lung it's a balloon. It spreads out. If you stretch it out, I told you the size of a tennis court. You have several million alveoli. So if you look at the lung, it's an air pipe, splits like the air patch, just like a bunch of grapes. You've seen a bunch of grapes, those stalks, like 23 times it splits, and you have the grapes at the end. Those are the alveoli, and that's where the gas exchange happens. When you do a scan, essentially you're doing like a 3-dimensional section. It's called high resolution because it's a little higher resolution, and it's computed tomography. That's the name that's held on. And tomography really means you're looking inside a structure. So when you're looking at HRCT, you're looking at it at 1 millimeter or less intervals. You're slicing the lung and essentially taking sideways X-rays of the lung. A CT scan is about 160 X-rays worth of radiation. So we really don't want to do it unless you need it. And when you look at the scan, we're looking at the different parts of the lung. The lung has 3 lobes on the right, 2 on the left, and they again split into many parts. So if you were to think there's about 25 little pieces of the lung, we try to quantify and say, okay, this much of the lung is involved. So there have been criteria used saying if it's more than 10 to 11, it's severe or moderate. If it's less than that, it means something. But as a pulmonologist and a radiologist, we're looking at several things. We're looking at how much of the lung is involved. What is the pattern? Is there something called ground glass? You might have heard the word GGO, ground glass opacities. Now, ground glass, incidentally, is, you've all seen is glass, which is clear. Then you have glass that is kind of opaque. That's called ground glass. So when you look at a scan, it actually looks like a little hazy stuff. We look to see what parts are involved. And sometimes we try to look for blood clots in the lung also. So these are all the different things we're looking at. In India, because of prior dust exposure, prior tuberculosis, prior other medical problems, we already see changes on the lung. I've already in the last year picked up several patients who had TB and not COVID, lung cancer and not COVID, bronchiectasis and not COVID, or all of these conditions and COVID. So one of the things that's happening is I picked up stuff which we wouldn't have known about unless we did the scan. I'm sure, Padma, you've heard me say this before, tobacco kills. I'm sure you know that. We've actually picked up stuff which has caused damage to the lungs on the CT scan because of tobacco use. So do your best to avoid tobacco. It's very important that you stop smoking, especially if you are at a higher risk of getting COVID. Many patients do have COPD, which they don't know about, which you sometimes pick up on the scan. And as you know, at a hospital, for example, we're looking at all these things. We're not just looking at COVID. We're looking at it more comprehensively because once COVID is done, you still have to take care of the rest of your health. We've picked up people with high blood pressure, people with diabetes who didn't know they had it. So COVID, in my mind, has had a positive slant towards early detection of many diseases. And we do have many programs to try and pick these up on a regular basis, but COVID has actually accelerated that. And there has been some, I don't know if it's good, but some good that has come out of the pandemic.
Yeah, I wanted to answer my next question where I was going to ask, am I at high risk if I'm a smoker? So we move on to the next one. I'm a known case of asthma. Am I prone to COVID-19?
So surprisingly, the data has been mixed. When the pandemic started, we thought we're going to see all these asthmatics kind of have these really severe symptoms. It's not been that much, and that's been a surprise. Some studies have suggested maybe there is a signal that patients with asthma are more prone, but in general, they've managed, and I'm not 100% sure why. It may be because they're already using inhalers. It's possible that their inflammation in the lungs has been well controlled. So it's probably important that if you're an asthmatic, obviously avoid triggers, keep an eye on your peak flow, be in touch with your doctor to make sure that you're on the right medicines, which are both a controller and a suppressor. So the inflammation business I talked to you about, when you get hurt, you get a swelling, the air passages in asthma, allergens go in, you breathe something in, the air passages kind of get narrow. You give medicines to cut the inflammation, which are actually low-dose steroids. And then you also give medicines to relax the pipes. So those are actually helpful in asthma, and they may be helpful in COVID also. And maybe that's why there's not that many. But you should watch out because you can get into a flare-up, and it's easy to treat if you catch it early.
So in the medical management, you did talk about the antiviral drugs that are available, and you did touch upon the antibiotics and the steroids. So it is best to leave it to your healthcare provider to decide what is needed for you. Don't panic, as you have mentioned. So is there anything that you want to add upon specifically drugs around what we talked about?
Sure. See, I think in terms of steroid use, the study showed that 6 milligrams of a drug called dexamethasone is helpful for a short duration, 5 days. But we have seen some degree of variability in how we use it. and you should leave it to your doctor to actually kind of titrate your dose of steroid. Now, your body actually makes a lot of steroid, and you need that to survive. And you need a certain level of steroid, and the steroid level fluctuates on a 24-hour basis. The adrenal gland, which sits on top of your kidneys, is producing these. If you take medicines from the outside, steroid from the outside, your body has an amazing feedback mechanism where the feedback mechanism actually controls the steroid level and is able to actually control how much steroid is in your body on a minute-to-minute basis. If you do give steroids from the outside, you may suppress this mechanism, and it's possible that your body doesn't know how much steroid to produce. And you could end up in a situation where your body says, you know what, I'm getting steroid from outside, let me not make any more. Once you stop taking steroids, it's possible that your body is not yet restarted it. And in that situation, if your body gets stressed, you may not have adequate steroid. So it's important to kind of talk to your doctor about the dose of the steroid. When you take steroids, there are possible side effects, including high glucose, even in non-diabetics. And if you're a diabetic, you should absolutely talk to your doctor about controlling your sugar more aggressively when you have a steroid dose on board. Long-term steroids suppress immunity. And you can get rare infections, including fungal infections, as well as infections that actually live in your body and don't hurt you. But when you suppress the immunity, they can flare up. These include things like fungal infections, which I mentioned, like mucormycosis, for example, or it can be a very rare lung infection called pneumocystis. So these are things which can happen, and you need to watch out for those. Steroids can weaken your bones if you take it for a very long time. You should also watch out for difficulty in sleep and anxiety, which can be triggered by steroids. They may increase your appetite and people may gain weight, but these are all long-term side effects. Most patients don't require more than a very short duration, which may be 5 to 10 days. Some people do require a longer course of steroids where you have to watch for these side effects, and your prescribing doctor 100% will be aware of this. If they are not mentioned it, you can ask them those questions.
I'm going to make what is the plasma therapy and what are monoclonal antibodies? When are these advised?
Sure. So plasma therapy is essentially, so we talked about our body fighting infection. So you're actually producing antibodies. So anybody who gets infection for anything, forget COVID, take ancient diseases. There are many diseases we have had before where you end up with antibodies being used to treat the infection. So person A gets a new infection. 2 weeks later, his body's made enough antibodies. Person B gets a new infection. His body has not yet made the antibodies. If you can match their blood groups and give the blood from person A to person B after processing it, you passively get antibodies which can fight the infection. And there have been controversy about whether it helps or not, but anecdotally, many patients have benefited from it. The antibody therapies, as far as I know, are not yet available in India, but these are experimentally made antibodies which go and fight and latch on to infection. So one of the good things about the pandemic, which I talked about before, is people are very interested in science now. Science is fairly predictable. You don't have all the answers, but it's fairly predictable. So if you actually look at the field of immunology, everybody's on Google now. Just Google everything that I've told you, you'll get pages and pages of stuff. But if you look at an antibody structure, it's actually pretty interesting. It's shaped like a Y, and it can go and actually attach to another receptor and trigger a whole cascade of reactions. So antibodies are actually going and capturing different receptors on the cells or on the virus to block it from actually making any effect on the person. Vaccines also generate such antibodies, which go and help latch on to places where the virus might sit, not giving it space.
So should post-exposure prophylaxis be used for people who may have been exposed to a COVID-positive patient?
If you are living in Washington, D.C., in the White House, you would probably get it right away. I personally know of no other place in the world that can get it that fast. But at the same time, there are places in other countries where patients have received it early on, where you can actually get it and it could be used. In our country, as far as in India right now, I have not seen it available. If you have access to it, it is absolutely something to consider as an immediate therapy. And this is similar to what we use in, say, rabies. When people get bitten by dogs, They get rabies immunoglobulin, which is a similar thing. It is generated against the virus that causes the rabies infection. Likewise, there are antibodies against these things. People who get snake bites get snake bite antivenom. So it's a very similar principle where you're passively immunizing the patient against the infection.
So if someone has taken tuberculosis treatment for about 9 months back in 2018, can they take vaccine now?
So it's good that they took the TB treatment, because many patients don't know they have TB and they never get treatment. And it's good that they took the whole course of the treatment, because many patients don't take the whole course of treatment. So if they've actually taken the whole course of the treatment, they're cured. At the same time, if they have a tendency to a flare-up of tuberculosis, either because immunity is low or some other reason why they are having new symptoms of TB, they should be obviously evaluated for TB. But anybody can get a vaccine. There's a tiny, tiny list of contraindications to a vaccine. Pretty much most people with any medical condition can get a vaccine, including people who are on immunosuppressives. And that should be discussed with your doctor to say, do we need to adjust the dose of the immunosuppressive so that you get the maximum immune response when you take a vaccine.
Thank you, Dr. Sai. That concludes our question and answer session. It was a really interesting session in, starting from the body's, mechanism to various drugs and what are we doing and how we should not panic. In terms of, even it went in addressing the mental health issues, could be if you're stressed, it will lead into something else. So thank you so much for this session. It was very informative. So do watch us out for next session tomorrow at the same time. Topic is managing NCDs during COVID-19, a special episode on diabetes by Dr. R.N. Mehrotra, endocrinologist from Apollo Hospitals. If you have any more queries, please reach us out through the FB Messenger or in the comment section. Until then, take care, be safe. Don't forget to SMS as social distancing / physical distancing, as Dr. Sai mentioned, and mask always on as for sanitization. Thank you and namaste.